This evening, I have Councilmember Edward Pollard of District J with me, and Dr. Persse is with me, Director Steve Williams, Chief Pena with the Fire Department, that's with me today. Today, the Houston Health Department is reporting 349 new cases of COVID-19, bringing Houston's total to 58,903. So that's 349 new cases testing positive. Sadly, there are 10 newly reported deaths as a result of COVID-19, bringing the city's total to 665. So 349 new positive cases, 10 more people who have died, and they are on your screen. Once again, the numbers reflect that the Hispanic community is being overly represented in these numbers. And then the number also includes a person in their 50s and two in their 60s, including one who did not have any underlying health conditions. I want to encourage one more time everyone to get tested. There are plenty of testing sites in the Houston area, 5 mega testing sites, 15 other additional testing sites all throughout the city of Houston. And again, better to know than not to know. And at least 40% of people who are walking around in the city of Houston are without symptoms, no symptoms at all, feel fine, look great, but they are carrying this virus. So getting tested at a Houston Health Department affiliate is free and does not require proof of residence or citizenship. So doesn't cost you anything, free testing, and anyone can go and get tested. And if you don't like the nasal swab, you can go to the Minute Maid parking lot downtown, and they have the saliva test. Our partner sites provide tests using nasal or oral swabs, and getting tested will help you know if you're positive for the virus. And then this Saturday, the Houston Health Department's outreach team will be back canvassing in high positivity majority Hispanic communities. And what that means, they will be going out and about, handing out leaflets, knocking on doors, encouraging people to get tested, and providing them with educational material. Our goal is to educate and empower Houstonians with knowledge to prevent COVID-19, especially in high positivity areas. And during these days of canvassing over the previous weekends, our teams have reached 2,556 priority apartment units as part of our Better Together campaign. So again, you have to assume some personal responsibility here. We know how to slow down even more the progression of this virus, and it's important that we all exercise our duty to do just that. With regards to the Small Business Economic Relief Program, which started this morning at 8 a.m., the online applications open for the City of Houston's Small Business Economic Relief Program, SBERP program. The program will provide immediate and short-term grant assistance to small businesses and chambers of commerce that have been adversely impacted by the COVID-19 pandemic. In the first hour, there were 475 applications submitted. And as of 3 p.m. today, 2,159 applications have been submitted, with another 957 pending. So in the first hour, there were more than 475 applications. Now, as of 3 o'clock, 2,159 applications have been submitted, and there are 957 others that are pending as we speak. We know the need is great because the virus has disrupted businesses across the country, and the grants can be up to about $50,000. And this is money that may be used for payrolls, accounts payables, rent, mortgage, personal protective equipment for employees, and marketing strategies, including creating an online presence and other sales opportunity. The application deadline is 11:59 p.m. on Friday, September the 4th, and must be completed online at www.cityofhouston- S is in Sam, B is in boy, E is in Ethel, R is in Robert, P is in Paul.org. And then in addition to that, today City Council approved a program for the Mayor's Office of Cultural Affairs to provide $2 million for relief grants to creative businesses hit hard by the COVID pandemic. The program would help close the gaps for many in the arts and cultural sector that have been unable to access avenues of relief provided to other businesses. The program is open to the 1,236 creative businesses previously vetted for grants from the Mayor's Office of Cultural Affairs and have suffered business losses due to the pandemic. That's in addition to the Small Business Economic Relief Program. These are important local businesses that have been severely impacted financially, and funding for the program will come from the city's federal CARES and Act allocation. Individuals will be eligible for grants up to $1,000 and nonprofit organizations for grants up to $15,000. To apply for this program, you may reach out to Debbie McNulty, the Director of the Mayor's Office of Cultural Affairs, and Debbie is right in front of me. So those are for those in our creative community, our arts and culture sector, and that's in addition to the Small Business Economic Relief Program. So please take the opportunity to apply. Let me pause right there and bring up Dr. Persse.
Thank you, Mayor. I'm going to start off with where I'm going to end up here. So a couple of points. One is the situation in our hospitals continues to improve. This morning I spent quite a bit of time talking with Dr. Persse from Harris Health, and we meet with him regularly, we being Dr. Shaw from Harris County and I, and the hospital situation continues to improve, and that the number of patients being admitted per day on average who have COVID diagnoses continues to drop. And then, therefore, in concert with that, the census, the number of patients in the hospital that have COVID disease is also falling. And probably most importantly, the percentage of folks that are in the ICU or taking ICU beds continues to decline at a fairly steady pace. It's not dropping precipitously, but it's dropping at a steady pace, and so that continues to improve. The other thing I want to talk about is to clear up a little bit of confusion. So last Monday, not 2 days ago, but the Monday before, we reported a positivity rate of 14.6%. And then yesterday, late, we reported a positivity rate of 15.9. Now, the reason that we delayed was because the state reported, or the state actually had an upgrade of their computer system. And the governor reported out yesterday that the state had been able to handle about 45,000 test results per day. And with their new computer system, that greatly increased. And so with that, we got a large bolus of new information that came in that had been sort of backlogged, if you will, at the state level. Through no fault of their own, it was the computer was simply overwhelmed with the amount of data. So this chart that you're looking at shows the number of reports that we get per day. And really all I want you to look at is off to the far right, being the last week, you can see the sudden increase in the number of reports of test results that we got over the last week. And when that data comes to us, we have to sort through it to make sure that there are no duplicates, that we don't have Mr. Smith from 123 Main Street in there twice, because sometimes people get tested multiple times. And also sometimes the labs, for whatever unknown reason, will actually send us duplicate test results. We have to get all those out. And then the other thing we have to do is we have to make sure that these are City of Houston residents and not, for example, somebody lives in Bel Air or Pasadena or one of the neighboring communities. So that takes a little bit of work to clear that out. And so that's one reason why we had the delay. Now, the other reason we had the delay, if we go to the next slide, you will see that the positivity rate was we went back because while all of those tests came in over the last week, those were not performed in the last week. Those were tests that were obtained over the many, many previous weeks. And so when we corrected for the date that the sample was obtained, and we put into our data, we recalculated the positivity rate, you will see that it shifted the curve upward, suggesting that the positivity rate was higher. That's also a little bit misleading because remember that when this all began, as the labs were reporting data to us, the most important test result was a positive test result. And so it's important that the patient get that test result as quick as possible, but also that the local health department get that test result so that we can begin our case investigation and contact tracing. And so the labs are now doing that, and they've been doing that for quite some time. But that means that there is on any given day, and through this mechanism, will get positive test results days before we get the negative test results for tests performed on the same day. So that will shift this curve upward. So if you look at the curve, you can see that the gray line, which is what we had been reporting, and the purple line are very much in parallel with each other. In fact, you can see they're only about 1% different going back to the beginning of July in the chart, but on the line graph, you can see even going back to the beginning of April, they paralleled quite nicely together. And that's because the negatives finally caught up with the positive test results, and when we calculate them in, they paralleled quite nicely. So this separation that we see here today may be an artifact because we have not received, for example, tests that were performed on July 29th to just pick a day. We don't necessarily have all the negative test results for July 29th right now. So when you look at that, let's say July 31st, the positivity rate that we had reported was 19%. With the new data, it's 26.9. But there may be a bias because we don't have all the negative test results in just yet. So that being the case, if we just look at the purple line, and on that chart, those are the August 14th rate, because that's the date. We had the data to calculate on August the 14th, which was last Friday. You will see that the good news is that while the number appears to have gone up, it really didn't. The numbers as we go down that chart, and as you see on the purple line of the graph, continue to drop. And what I really like to draw your attention to is that the slope of that decline seems to be increasing, which means that our efforts are working. So the number may have changed. And another thing to remind you, we've been saying from the beginning, don't fixate on any one number. In fact, don't even fixate on one metric like positivity rate, but look at how things are moving. So the message remains the same. The positivity rate is decreasing. Wearing masks is working. Avoiding large gatherings is working. Don't go to school or work if you're sick. Wash your hands frequently and get tested. Now, with that last point, our ability to measure positivity rate, as you can imagine, is also directly related to how many tests are performed. So while this is good information, I remain concerned that we have so few people going to get tested that at some point that will cross a threshold where its predictive ability will be tarnished. There won't be enough of a sample to know what's really going on in the community. So once again, I want to make everybody know the hospital situation is improving. Our positivity rate is decreasing in spite of a little bit of confusion. This is a good problem to have. The state got new computers and gave us more information in a more timely fashion. That's a good problem to have. We're explaining what happened. But we do need to have people still go and get tested. And so remember, if you go and get tested, if you don't have any signs, you don't have any symptoms, but you want to get tested, as the mayor just pointed out, 40% of the folks who are infected have no idea that they're infected. They have no signs or symptoms, which means those are the exact people who are most likely to spread the virus, number one, to their family members, number two, to their coworkers, and number three, to their neighbors and friends. So even though you may not have any symptoms, we still want people to get tested. If somebody is symptomatic and they don't feel good, or they've been exposed to a known case and they go get tested, well, once they know they've been exposed to a known case, or once they develop symptoms, they should be isolating themselves and slowing down the spread of the virus by isolating themselves. And I believe that Houstonians are doing that. So that means that the individual we worry about is the person who doesn't have any symptoms, thinks they're fine, and may actually be infected because they're the one that's out unknowingly spreading the virus. So it's really important for two reasons. It's important to you to go to get tested so that if you're one of those folks that's spreading the virus unknowingly because you don't have any symptoms, that you can then stop spreading the virus to your family. And number two, by having lots of folks go and get tested, we will continue to have a good grasp on the positivity rate and make sure that it continues to fall, because that is then related to things like opening schools. So this is all very important. This is really all good news. A little bit of confusion, got it cleared up, and I think that's my report.
Thank you. And I want to emphasize the positivity rate because within our Texas Medical Center hospitals, based on the numbers that I see every single day, the latest numbers today, for example, the positivity rate within TMC hospitals covering a 9-county region, was 8.6% within the hospitals. Those are the people coming to the hospitals and them testing. But what we need is that positivity rate within the community itself. The end goal is to get us down to 5% and below, and to stay at 5% or below. And so as of August the 14th, we were at 15.9%. And so we need everyone to continue to keep your masks on, avoid those large gatherings, at the restaurants, on the patios and all of that, the backyard parties, keep your masks on, the social gathering, and let's stay focused because the goal remains, and is to get down to a positivity rate of 5% and to keep it at 5% or below. That will give everyone that added comfort about, for example, kids returning to school at some point this fall. So that's the goal. That slope. If you put that diagram back up where it was going down, sloping down, because we needed to keep coming down, not be a roller coaster, but to come all the way down. We need to crush that curve. Not to just slow it down. We need to crush it. And so we need everyone to be very, very, very focused over the next several weeks, so that at the end of August, we can truly say that the positivity rate in the city of Houston is 5% or below. Having said that, let me bring up Chief Pena. Let me also ask, before he comes, for us to continue to offer our prayers for the firefighter that remains in the hospital. Chief Pena.
Thank you, Mayor. I'd like to first give you an update on Captain Persse. He is still in ICU. He is still in critical condition, but I've been assured and understand that he's got some of the best doctors available that here in the city working on him and his case, and that he's been getting some experimental medications and drugs, and we're hoping that he pulls through. So if you believe in prayer or just the power of positive energy, please send it to Captain Persse and his family, and we keep them certainly in our thoughts. Our quarantine numbers for the fire department are below 100, and that's the first time we've been below 100 in a long time. We're at 86 firefighters in quarantine. We have 35 that are positive for coronavirus. In total, we've had 241 that have been positive. The majority of those, 206, have returned to work. At this moment, we have just one firefighter who is in the hospital. That's Captain Persse, and again, please keep him in your prayers. In regards to our occupancy task force, we have 36 complaints that we responded to in the last 24 hours. No business was referred to TABC. Again, thank the business community for their assistance in helping us manage this issue. I'm going to give the police department's numbers as well. Quarantine for police department, they have 106 employees currently in quarantine. To date, they've had 470 employees that have tested positive for coronavirus. 429 of those have been classified officers, 41 civilians. As of this moment, they have 381 employees that have returned to work. So again, I want to echo what Mayor Turner and Dr. Persse have mentioned about continuing on with wearing the mask, physical distancing, and proper hygiene, and getting tested. Very important in helping us combat this virus. That's my report, Mayor. Thank you.
Thank you. And we're in the third day of the rental assistance program. As of today, more than 2,700 landlords, apartment complexes have signed up agreeing to the terms that we've put forth in terms of receiving dollars, not evicting anyone in that particular complex, and I suspect the number will continue to increase. But as of today, it just opened up on Monday. More than 2,700 have agreed to participate in the program, and then as of Monday morning, tenants can start applying for the rental assistance as well.